If the patient has had a recent episode of care at the hospital, it is possible to transfer medication details from that episode to the current one. This should only be done for recent episodes and only once you have checked that the patient is still taking this medication, as there is a risk that the medications may have been changed or stopped since the last episode. This is particularly useful for readmissions where the patients are on multiple regular medications. In this example, we are on the inpatient prescription chart and can select Transfer From. You will need to select the previous episode, so click on the Transfer From drop-down. You can see in the Transfer From drop-down list, you can choose to select from either medications on admission, inpatient medications, or discharge medications, with the dates that they were last updated for that episode. Not all episodes will display in this list. Only those within the last few months will be displayed. We want to use the most recent list, so we'll select the Discharge Medications from the 26th of the 5th, 19, 5 o'clock. You now have the list to select from. At this point, you would check which medications are still being taken by the patient. In this example, all of these except the amoxicillin are still current medications for the patient. Take care with any medications that were prescribed as a course, and remember that new prescriptions may need to be added if the patient's GP has commenced any new medications. We will quickly select the relevant medications for you. With all the medications selected, we can click on Continue. You may see class duplication alerts in this example for Seretide and salbutamol inhalers. Make sure you read the warning and take the appropriate action. In this example, we are going to override the warning for salbutamol sulfate and the warning for Seretide. We can now click on Continue. You are presented with the Schedule and Details window. Check the start dates and times. These can be edited if required. Be careful when prescribing after main dose times. For example, after 9 AM, that the start date and time is appropriate. We are happy to accept the defaults, so we can click on Continue. The Medication to be added screen is your last chance to check the medication and amend it if required. Remember, you are prescribing these medications to the inpatient chart. We know this as it has a white background. We are happy with the information, so we can click on Update. We are returned to the Schedule tab, and you can see the medication that has been added from the previous inpatient episode. This is a handy way to re-prescribe regular medications, but it is very important that all details are checked, and only medications that are appropriate are transferred. Remember to check the episode dates. Previous discharge medication lists are the most appropriate to work from. However, if the patient was admitted to acute medical or surgical areas, the discharge prescription list won't always display the full list of medicines, as only the new and changed medication are added onto their discharge prescriptions.